Coronary heart disease is a common condition. For about 1 in 4 people over 65 years of age, it's just part of getting older. In this short video, we will hear from 6 people living with coronary heart disease. They have all had angioplasty treatment for angina and have been kind enough to share their stories with us. Your heart is your largest muscle, and its job is to pump blood around your body. 3 pipes called coronary arteries carry blood and oxygen to the heart so it can do its work. When you exert yourself, like walking upstairs or making a bed, your heart muscle needs more oxygen-rich blood because it has to work harder. As people age, coronary arteries can become narrowed with fatty deposits, and this restricts the flow of oxygen-rich blood to the heart muscle, leading to pain or discomfort known as angina. Angioplasty is a treatment that relieves angina pain because it improves blood flow to the heart.
Angioplasty is a treatment in which narrowings in the heart arteries are stretched open with a balloon. And most angioplasty treatments are done to treat patients with angina, although sometimes they can be done for other reasons. The procedure for those people who've had an angiogram in the past is almost identical to their angiogram, although it may take a little bit longer. But for those patients who haven't had an angiogram, then the procedure involves putting a very small plastic introducer tube into the wrist or into the groin through a small local anaesthetic injection in the skin. So the procedure is done whilst you're awake. Generally it takes between half an hour to an hour, although it can sometimes take a little bit longer. The procedure is done using X-ray, and what we do is put a small tube with a balloon with a stent mounted on the balloon through the wrist or the groin up to the heart using the X-ray camera to see where we're positioning it. The balloon is then inflated, which leaves the stent expanded within the artery, and then the balloon is removed. The stent heals up within the artery so that once it's in, it cannot move, and usually gives a permanent relief of angina symptoms.
Angina occurs when narrowed arteries to the heart cause chest pain, discomfort, or breathlessness. Angioplasty unblocks these arteries, allowing blood to flow normally to the heart muscle. Angina is very common, and most people can still live a full and active life with it. The hospital stay for angioplasty is short, usually 24 to 48 hours. You will be asked to shave your groin the night before. Please bring an overnight bag with you and any medications you may be taking. It's probably best to leave valuables at home.
Hi, I've come for an angioplasty, Pat Fisher.
Pat Fisher. Right, lovely. When they arrive on the ward, they will be shown to their bed, and the nurse who's looking after them that day will take some details from them, ask them if they're allergic to anything, put on the name band, we'll take down all the medications. The doctor will come and explain the consent form to them, and then the patient will obviously sign the consent. We'll ask them then to put on a gown and some paper knickers, and depending on when their procedure is, either in the morning or the afternoon, they will be walked into the cath lab.
It's not painful at all. It was all I was frightened of when I was having the angioplasty was I hope I don't get cramp because you've got to lay still, and it seems quite a long time to lay still, to keep still, because of where it goes from your groin up. But I would say you don't feel anything at all. You just see it on the monitor, and that's it's like the easiest thing that's ever happened to me in the hospital.
Some people find angioplasty treatment painful, but most people don't. everybody is different. If you do have any pain at any time during your hospital stay, please tell the staff so they can help you.
Following the patient's procedure, they'll be wheeled back to the ward on the bed. The nurse looking after the patient will connect them up to the monitoring equipment. The nurse will also then every half an hour check the patient's pulse, blood pressure and puncture site for signs of bleeding. Once the nurse is happy with this, the patient will then be able to have a drink and something to eat. If the patient's had the procedure through the groin, they'll have to lay relatively flat just for a couple of hours until the introducer has been removed. Then they'll have a further couple of hours until the nurse is happy with the condition. At that time then, the patient will be able to get up out of bed. If they've had the procedure through the wrist, the patient can sit up straight away. However, bed rest is still the same, normally about 4 hours. If there's no problems and the nurse is happy with the patient is usually discharged anything between 12 and 24 hours later.
Please take your medications with you. Pressure will be applied to the puncture site in your groin or wrist after treatment. Your hospital stay is short, 24 to 48 hours. You will be on bed rest for about 4 hours. Ensure that a friend or relative can take you home after your treatment.
Patients often ask whether they'll experience any pain following the angioplasty treatment. It's quite common for patients to experience some pain or discomfort at the entry site in the wrist or the groin, and that usually settles down within a few days. They can also notice some bruising at the entry site, which can take a few days to heal. But if there are any concerns, then the patient should see their GP. Usually, the angioplasty treatment gives relief of the angina symptoms, but occasionally patients can continue to experience some angina despite the stent treatment, and may need to use their GTN spray or tablets if they've been prescribed. It is quite common for patients to experience a mild bruised sensation in the chest after the angioplasty treatment, which can last from between a few hours to a few days. This might be because the artery has been stretched by the stent and is nothing to worry about. If, for any reason, patients experience severe pain in the chest that doesn't settle, then they should use the 15-minute rule, and if the pain doesn't go away, should call an ambulance.
The 15-minute rule explains what you should do if you experience chest pain or discomfort. We are giving you this advice not because we think you will get angina or have a heart attack, but just in case you do. If you do get pain or discomfort in your chest, stop what you are doing, sit down, and try to relax. If the feeling hasn't gone after 2 to 3 minutes, and you have been prescribed GTN tablets or spray, take one spray or tablet under the tongue and then wait 5 minutes. If the feeling continues, take a second spray or tablet and wait 5 minutes. If the feeling still isn't relieved, take a third spray or tablet and wait a further 5 minutes. In most cases, your pain or discomfort will be relieved. If the feeling is still present, dial 999 and ask for an ambulance. Please do not drive to hospital, as ambulance staff can start treatment immediately if you should need it.
One of the medicines that you might be prescribed is called GTN. GTN is usually prescribed to relieve the pain of angina or chest pain that you might be getting from angina. It works by dilating blood vessels And by dilating the blood vessels, it reduces the workload on the heart and might improve the blood reaching the heart as well. The GTN medicine comes in two different forms. One form is the spray form, and the other form is the tablet form. The difference between them is that the spray form has got a longer shelf life, which lasts for a few years, whereas the tablets last only for 8 weeks once the bottle is opened, and it might be a good idea to write the date on the bottle once you've opened it. When you prescribe these medicines, and not everyone will be prescribed it, it's a good idea to carry one with you in addition to the one that you might have at home, just in case you need to use it.
The time that I have to sort of use my spray nowadays is that usually when I make my bed, by pulling the covers, it drags me and I get tight and I can't breathe. It's a strange sensation, so I have a spray in my bedroom anyway outside of the bed. So I usually either have 1 or 2 squirts of it, sit down on the edge of the bed until the feeling subsides. And then I just get up and continue doing what I was doing in the first place. Finish it off.
I'd gone on the bus, and the buses are only every half an hour, and of course I saw the bus was in and rushed for it. And I know I shouldn't have done, I should have waited for the next bus. And I couldn't get sat down quick enough on the bus to use the spray then. It was a lifesaver, I felt.
जब मैं लीड अस्पताल से वापस आया तो डॉक्टर ने एक बात और मुझे बताई जो बहुत ज़रूरी है कि जब मैं वॉक करने के लिए जाऊं तो स्प्रे अपनी पॉकेट में रखूं। तो वो मैं हर वक्त जेब में ही रखता हूं। तो अल्लाह का शुक्र है कि अब पहले की निस्बत में ज़्यादा वॉक कर सकता हूं, तो मुझे स्प्रे यूज़ करने की ज़रूरत नहीं पड़ती। लेकिन जब कभी चढ़ाई वाली जगह आ जाए, जैसा कि 2-3 दिन पहले मैं जुम्मे के दिन मस्जिद में गया जो थोड़ी दूर है, तो उसमें रास्ते में चढ़ाई आती है, तो वहाँ मुझे शोल्डर में दर्द शुरू हो जाता है जब सांस रुके। तो मैं 2 स्प्रे यूज़ करके फिर 5 मिनट के लिए बैठ जाता हूँ, तो फिर ठीक हो जाता है। उसके बाद दोबारा चलना शुरू कर दिया मैंने। तो थोड़ा बहुत दर्द होता है सिर में और गला में थोड़ा टेस्ट ख़राब हो जाता है, लेकिन इससे घबराने वाली कोई बात नहीं, उसका फ़ायदा बड़ा है।
The entry wound in your groin or wrist may be sore and bruised for a few days. If you experience chest pain or discomfort that lasts longer than 2 to 3 minutes, use the 15-minute rule. If you are prescribed GTN, carry it with you.
Patients who were diagnosed to have coronary artery disease, disease affecting the arteries of the heart, are likely to prescribe certain medicines to prevent the worsening of the condition and reduce the frequency of getting chest pain. These medicines include things like aspirin, Glyceryl, cholesterol-lowering medicines such as statins, ACE inhibitors, and beta blockers.
I know some people don't like to be on medicines, don't like to be on drugs regularly, but I accept that I need these. I understand what they are for, each of them, and realise that, yes, they're helping, that they're helping my blood not to be sticky, to be thinner, to flow more easily. And therefore, of course, I'm going to take them. Of course I am. I'm very grateful they're there. To help me remember to take my medicines, I have a dossette organising that my medicines for the week, each day is divided into 4 sections, and that tells me whether I have taken them or not. A dosette is wonderful.
My wife went to the chemist one day and she inquired about it, and she came home with this 7-day box with 7 compartments in. So now each week I fill each compartment up with my required doses, and that's how I remember, because they're all dated Monday, Tuesday, Wednesday, Thursday and that. And quite honest, I never miss taking my tablets. I always take them.
Some people experience side effects from their medications. However, this varies from person to person. Your GP, pharmacist or practice nurse are all people you can approach for information. It is important not to stop any of your medications without getting medical advice.
Lovely. Thank you. Thanks very much. Thank you. Bye. Bye.
Take your medicines as prescribed to improve your heart health. Do not stop taking them without first seeking medical advice. You can get advice from your GP, practice nurse or pharmacist. Being told you have heart disease can come as a shock. People often need time to adjust. Family and friends can be a great source of support.
After an angioplasty, people typically feel a whole range of different emotions and feelings, and there is no right or wrong way to feel. Sometimes people might feel a bit irritable or a bit angry or fed up or frustrated that their recovery is not happening as quickly as they'd like. But on the other hand, many people often feel relieved that the whole thing's over and done with, and they can look forward to getting on with life again.
I think the role of the partner is very, very important. The partner can do a lot without sometimes realising it. That verbal, psychological support, encouraging the person not to give up things, not to change their life drastically just because they've had this sort of illness. And I think it's vitally important that the partner should always be optimistic. Try and make sure that the person who's suffered the illness doesn't get down in the doldrums too much. You raise their hopes. Make sure that they realise that things will, in all probability, get a lot better.
In the immediate time after the procedure, many people find it helpful to speak to their friends or close family about how they're feeling and talk through those emotions. The cardiac rehabilitation team or the GP are also very helpful. I think a bit further down the line, if people are getting stuck and worrying about what they can and can't do, or their mood's quite low, the cardiac rehabilitation team might refer somebody to myself, and the clinical psychologist would then get involved and offer specialist advice and support so that people can get back to where they want to be with their lives.
There is no right or wrong way to feel. It may take time for you and those close to you to adjust to living with heart disease. If you feel down and this persists over a period of months, consult your GP.
Smoking is by far and away the biggest risk factor for heart disease, so patients should stop smoking as soon as they can in order to reduce the future risks. We accept this is not easy to do, but stopping smoking is far more powerful than the medications you will be prescribed to keep your heart healthy in the long term.
I was helped by certain things, such as I never smoked in the house. The dustbin and I used to be very great friends. My children's attitude, and seeing little ones, my precious little ones, at the foot of that bed in the hospital that night, fighting back tears. And I wasn't going to do that to them again. That's what helped. That's what helped. The effect on other people. But actually giving up nicotine was bad news. And hard to do. But I've done it.
If a patient decides to quit smoking after an angioplasty, there's lots of support and advice available. Firstly, through the GP, they can help by prescribing nicotine replacement therapy, and there's lots of different types of nicotine replacement therapy that are available through nicotine patches, inhalators, or even medication, and they can double your chances of quitting successfully. The practice nurse can also help by providing information and support. Alternatively, you can go to the NHS smoke-free service, and you can access that via the internet. They can give you more advice and information on stopping smoking, but also provide information about local services, such as group support, one-to-one support, or home-based support, and that can be via text message, email, telephone, or even post.
Quitting smoking will improve your heart health more than anything else. Seek help from your GP, practice nurse or pharmacist who can advise you where you can get help to quit. Don't stop trying if you don't succeed straight away.
If I was thinking about the do's and don'ts of eating in a heart-healthy way, I would really think of 3 main points. The first one being eat plenty of fruits and vegetables, and we say aim for 5 portions of fruits and vegetables every day, and it's really important to get a good variety of these foods. They contain really good vitamins and minerals that are so protective to our hearts. The second point I would make is eat plenty of fish, particularly oily fish, and those fish include things like pilchards, sardines, mackerel, salmon, lots of varieties, and they contain omega-3, which again are really protective to our hearts. The third point I would make is try and reduce the amounts of saturated fat that you're taking in. So we're talking about fats from animal sources. So try and remove visible fat from meats, avoid using butter and lard when you're cooking, and try and choose lower fat varieties of the dairy products that you enjoy. And also think about the calories that you're consuming. So if you're trying to lose weight, remember that fat contains lots of calories, so we just need to be reducing the amount of total fat that we're eating. And eating healthily is really about making a lifestyle change, which we should be able to maintain. So it's important to enjoy our foods. So we should be able to include treats and eating out as part of our healthy eating plan. Now, if you're looking for more information about healthy eating or you're struggling with your diet, please seek advice from your doctor or your specialist nurse. And if you're really still struggling, then they can refer you to a dietitian for more specialist advice.
तो जब मैं हॉस्पिटल से वापस आया तो डॉक्टर ने बहुत सारी बाकी बातों के अलावा मुझे ये भी कहा था कि रेड मीट कम खाऊं, तो मैंने काफ़ी कम कर दिया। उसकी बजाय वाइट मीट, मेरा मतलब है मुर्गी वगैरह या फ़िश और ताज़ा सब्ज़ियां, ये खाने में मैंने ज़्यादा ख्याल रखा और फिज़ी ड्रिंक भी छोड़ दिए। उसके बजाय मैं पानी पीता हूँ जो सेहत के लिए ज़्यादा अच्छा है।
I've now become more aware of the importance of oily fish and fish in general. Certainly make sure have our 5 portions of fruit and veg a day, and I am much more adventurous with a different use of fruit and vegetables. We have a lot of fruit in salads, for example.
I always have butter. I started having margarine. Full cream milk went to semi-skim milk.
Although I'm aware of what it is necessary to stick to things, I do occasionally treat myself or cheat on the diet. I'll have the full milk, or I'll have something with salt, or something that I shouldn't, probably bacon sandwich, but not bacon grilled. But I think it's nice to have a treat, just occasionally, as long as you don't overdo it. I'm aware that I've got to be a bit careful, otherwise I'm going to be back to square one.
Eat 5 portions of fruit and vegetables each day. Eat less animal fat. Eat more oily fish, at least 2 portions a week.
Exercise is a vitally important way to keep the heart healthy after angioplasty. The effects on the heart blood flow are immediate, but we normally advise avoiding any strenuous lifting for at least 3 days following an angioplasty to allow the puncture site in the groin or the wrist to heal. You should be able to get back to normal activities, which includes driving, a week after the procedure. Patients often ask when they can resume normal sexual activity, and again, that really depends from person to person, but generally if you feel comfortable, sex can be undertaken about a week after the procedure.
Exercise is very important after an angioplasty. It should be very individual for you, something that you enjoy. Can involve gardening, housework, walking, swimming, gym-based exercises. You're aiming to do 30 minutes a day on most days of the week. Exercise at a moderate level that will make you feel a little bit more breathless, a little bit sweaty, but not doing too much that you're gasping for air, so it's just what suits you. And you're aiming to progress over the weeks. It will make you feel better and improve your heart health.
जब मैं घर वापस आया हॉस्पिटल से तो 2-3 दिन तो बाहर मैं नहीं निकला, लेकिन फिर डॉक्टर ने मुझे बताया था कि आहिस्ता आहिस्ता वॉक करना है जितना आसानी से कर सकूं। सुबह अबाउट 9-10 बजे मैं वॉक के लिए जाता तो नाश्ता करने के बाद, और इसी तरह शाम को भी।
When it's pointed out to you that the heart is a muscle and to recover it needs exercise, then you get on with the exercise and behave sensibly, not to overdo it. If you feel a twinge or become tired, then you stop. Simple as that.
Before I had it done, I used to dance and probably go halfway through a dance and then had to sit down. So when we went back, I only did the easy ones, so that I danced the dance through and sat and rest, and then did another one. The ones that suited me, I did, until I gradually build up, and I do most of them now.
Some people find it difficult to exercise on their own. Cardiac rehabilitation is a program of education and exercise classes designed to help people living with heart disease to get back to regular exercise.
One of the benefits of cardiac rehabilitation is that you can meet other patients who have had heart problems such as heart attacks or angioplasties and get support from them.
Your GP or practice nurse will be able to tell you about cardiac rehabilitation services in your area. In the first week, avoid lifting heavy weights and driving. Gradually build up how much exercise you do. Aim for 30 minutes on most days.
Angioplasty is not a complete cure for coronary heart disease, but there are many things you can do to improve the health of your own heart when you go home, such as keeping physically active, eating a healthy diet, stopping smoking and taking your medication as prescribed. And maybe get your family and friends to support you in that change, and that can actually benefit the whole family to make that change.
After I had the procedure, I got that I could actually go upstairs without getting out of breath. I could go out of where I lived, out of the streets, up the hill without getting out of breath. I could go dancing and enjoy myself without having this tightness and heaviness in my chest.
तो तकरीबन 1 साल हो गया है जब ये एंजियोप्लास्टी वाला सिलसिला हुआ। उसके बाद मैं बहुत बेहतर फील करता हूँ और मेरा लाइफस्टाइल पहले की तरह हो गया है, जो बीमार होने से पहले जिस तरह मैं चलता फिरता था अब उसी तरह हूँ। और मैं अपने रिश्तेदारों के घर में भी जाता हूँ, वो भी आते हैं, मेरी बेटियाँ, बेटे, मेरे कज़न और दूसरे रिश्तेदार। उन्होंने इस दौरान मेरा बहुत ख्याल रखा और ये बड़ा ज़रूरी है कि इंसान एक दूसरे का ख्याल रखे। तो अल्लाह का शुक्र है कि मुझे अब कोई ज़्यादा प्रॉब्लम नहीं। I feel better.
Because she's put a lot of time in getting back to her fitness, and because she's been very careful with the diet, And because she's given up smoking and tailored her drinking, I think we are, as a household, more or less back to where we were.
I'm back to where I was, and in fact, having given up smoking, I'm fitter than I was. I know I am. I feel it. So I have a lot to be grateful for.
I've got my life back again. Yeah. Yes, I've got my life back again. Yeah.